Number one, a naturalistic lighting environment is essential for health. And people want to make that complicated, and it's not complicated. But you want to be able to go out and have a slice of cheesecake and drink a beer and, stay up late at night and do these things that people regard as stressful and unhealthy, not for the sake of doing them, but because when you're really healthy, you can do whatever you want. That's actually the craziest thing to me about COVID, the more I think about it, is that when you tell people en masse they're going to get sick, to what degree can you make them sick?
If you tell them they get sick.
Yeah, and if you tell them that they're going to get sick, to what degree can you make them worse? If you tell them that their next cold may be the one that kills them, will you not make that cold worse because their expectation is that it will make them worse?
Of course, yeah.
This is why the media is so dangerous. They're so dangerous.
A big shout out to today's sponsor, Ergomax. Innovative, scientifically based nutritional supplements for people who care about their health. Use the code Matthijs10 at the checkout for your 10% discount. Welcome to Matthijs. Today's guest is Dr. Leland Stillman. He practices natural and functional medicine with a systematic approach that addresses all aspects of diet, lifestyle, mindset, and environment to help people achieve optimal health and their highest potential. He takes the best of many disciplines and therapeutic modalities and works with you to develop a comprehensive plan to achieve your health and performance goals. He works with patients all over the world and also is one of the doctors I found about who is equipped with the best home audio equipment that I've seen on the internet so far. So, Dr. Leland, welcome to Matthijs. Thank you very much for taking the time. How is life at the moment on the other side of the ocean?
Things are great. Things are opening back up. We don't have to we're no longer mandated to wear masks anymore. Some of us didn't think we had to anyway. But things are good. Yeah, things are good over here. It's warming up too.
Yeah, nice. That's great. So
Thanks for having me, by the way.
The first things that you started doing, or what is possible again from the opening?
So over here, in Virginia, we had a mask mandate where we were, worried. I mean, I don't actually know what penalties were ever levied against people, but businesses pretty much enforced and refused service to people who were not masking. And a lot of restaurants closed. Some of my favorite restaurants went out of business for good. Oh. And that was really the only impact on life. Hardly anything else stayed closed. And things like haircutteries and barbershops reopened with masks, though. But now all that's going away.
Yeah. All right. Well, maybe to share a little bit more about you and why I decided to invite you for today is, like I said to you before, I found out about you due to quantumhealth.tv. I've been following Dr. Jack Kruse for quite some time, and I'm really interested in getting a better understanding of light, water, magnetism, and quantum biology, and how this all correlates to health, and why it is such important. Why it's so important to understand the fundamentals of those topics first before you go into nutrition, movement, etc. And why I've studied food and nutrition myself, so I have a background in food. But due to my own story and journey, I noticed health is so much more than just food. And I would really love to dive into some topics today with your background, and maybe we can start with a short biography of you, how you got into medicine, how you found out about light, water, magnetism, quantum biology. So
yeah, sure. So I got into medicine from an early age. I was very interested in why I wasn't healthy. I'd had lots of ear infections, almost got ear tubes as a child. And had a lot of sinus infections, allergies, things like that. I ended up growing out of most of that. I still have a chronic runny nose, though. And when I was in elementary school, I remember wondering why I was slower and weaker than the other kids. That really bothered me because I was always a very high achievement minded kid. I wanted to be the best. I don't even know why. I always wanted to be the best at whatever I did.
Were you the oldest of all the kids?
No, younger. I'm the younger sibling of one older sister.
All right.
And I was actually young for the grades that I was in, which may explain why I was slower and weaker than the other boys, because I obviously had less time to grow. Mm-hmm. But, one way or another, I never really thought about that. I just thought I want to be the best. So anyway, I got into high school and, became more aware of health, started reading about it, started learning about it, started applying what I was learning, and saw that what I ate would affect how I felt. Now, remember, this was, the early, well, actually, no, this was still, it was early 2000s. So we didn't have cell phones. We didn't have laptops. We didn't have computers. I think I had a laptop in high school. I did have laptops in high school, but I really have to think back, right, to what did I actually have? So the amount of screen time that we had was very low. And that's important because, I didn't appreciate how light, water, magnetism, these basic fundamental elemental forces affected biology at that time. But, because I got into nutrition, and at the time, everyone just health and wellness was all about nutrition. It's still 90% about about nutrition as far as what you read. The reason being that it's a lot more profitable to tell people to buy your supplements that, disappear into their body every single day than it is to sell them, say, a light panel that they may be able to use for 5 to 10 years. So I then went to college, then went to medical school. I went into general internal medicine, which basically means I specialize in sick adults. And actually, I was trained to manage chronic disease in my conventional training. Now I make it go away by helping people to optimize their environment so that their bodies come back into balance. So then I got into the natural medicine world after my conventional training and went to work for a mentor in Tampa, Florida, who was doing a lot of work with patients who'd had exposure to mold and who were suspected of having, things like, what is, loosely called chronic Lyme disease, which I don't really think most of which has to do with Lyme disease at all, which is something we can get into later. I ended up working for him for a couple of months and being amazed by some of the outcomes that I saw with, IV nutrition and bioidentical hormones and all the stuff that you see in the natural functional medicine world being, wielded by most clinicians outside the mainstream. But I saw people also get worse or not get better. And I decided there was something that I was missing. And a very astute patient of mine, because when you work with really sick patients who've traveled all over the world for their care, they know, or they've looked into just about everything out of desperation. Some of it's great. Some of it's terrible. All of it's got a place somewhere, with rare exceptions. And they really push you to try and think, well, maybe this is going to work for this patient. And one of these patients told me, look, you got to look into the work of this guy named Jack Kruse, who does, his whole thing is light, water, and magnetism. And I dove into the physics behind life and behind biology and behind medicine and was amazed that underneath all of the nutrition that I had been learning about and studying, underneath all the hormones, underneath all the neurotransmitters and the microbiome and all these other things, were factors affected by far more fundamental forces than simply, how much protein you ate in a day or a week. And it really suddenly put into perspective why I'd seen so many young people over the years with just strange, undiagnosed conditions. And I'd always puzzled over these patients because they were the kind of people who would go to a, 30-minute yoga class in the morning, and then they would have a green drink smoothie, and then they would have a salad for lunch, and then they would have, wild caught sockeye salmon with organic, spring mix and sweet potatoes for dinner. And they would tell you that they were chronically tired, depressed, anxious, had weird skin issues. They have to live this very rigid life in order to avoid symptoms. And what I found really puzzling about this was the sheer number of people who I met who didn't worry about anything with their health, didn't care about what they ate, and yet could operate at a higher level than some of these people working so hard to be so healthy. And the more I got into the physics of light, the more it began to make sense that I was seeing so many young people who were living these very connected, very digital lifestyles with a lot of wireless radiation and a lot of artificial light, and without much sunlight and natural sleep, becoming sick and not getting well even when they address their nutritional issues. Because if you don't address the fundamental forces in your life, your wellness will always escape you. It may be here today, it may come in and out of your life, but if you ignore light, water, electrical, magnetic fields, electromagnetic forces, you're going to be sick early, persistently, and maybe intermittently if you're lucky. But it's become such an interesting, my findings in this have just been confirmed over and over again the last few years as I've gotten more and more and more into it. And so now, I ended up sort of coming back around and finally having an integrated approach to all of this through, the method that I use now, which is called Balance Protocol. And now everything I do is very comprehensive, incorporating nutrition, light, water, electrical and magnetic fields, light therapy, air quality, breathing mechanics, the whole gamut of natural and holistic medicine.
So how, because you said you experienced some health troubles yourself at a younger age. How did that develop when you found out about all this knowledge?
Right. So for years I had been eating your listeners may have heard of the Weston A. Price Foundation. They're big in the natural holistic medicine world, at least here in the United States. So I had been eating the diet that they recommended and advocated for many years. Raw milk, dairy, pastured dairy, pastured meats, whole foods, natural foods, and a really wide range of foods. And then I ended up falling into Jack Kruse's work and became interested in his Epipaleo RX. And I ate his diet, which is a very heavy seafood, ketogenic, tends to be lower on the fruits and vegetables, depending on who you ask and what season you're in, what your health is and what your latitude is. And, then I ended up falling out of love with that because I didn't see the results with it that I wanted.
Well, were you aiming for?
Well, I just wanted optimal health and performance. And I just didn't really feel like I was feeling my best when I was on that diet. And then I ended up getting into Balance Protocol, and it just cracked the lid on all these other factors that determine basically what you ought to put in the engine. Whether you need more protein, less protein, what mix of macros you need, what your protein sources need to be. Do you need to focus on legumes? Do you need to incorporate more red meats? Should you avoid red meats? There's lots and lots of different caveats in the this protocol to determine what people really ought to be eating. And now I'm able to.
What kind of measurements do you use at the start to decide all of those variables?
Yeah, sure. So basically the testing that I get now is very comprehensive. And I want information that will effectively tell me everything that makes you, you. What does that look like? I want to know what neurotransmitter balance is. I want to know what your branch chain catabolites look like, which are markers for B vitamin deficiencies. I want to know what the Krebs cycle looks like. I want to know what chynurenic acid and quinolinic acid pathways are looking like. I want to know what your tyrosine metabolism is doing. I want to know what your glutathione levels are. I want to know what your fatty acid balance is. And I want to know what your amino acid levels are. And finally, I want to know what your minerals and heavy metal levels are. Because let's say that I get a patient who's got a high mercury level, but a low omega-3 level and a lack of overall protein in their blood. Well, that's somebody who needs more fish oil, but we got to find the source of mercury. Is it their amalgams? Is it that they eat some fish, but it's only swordfish and tuna, which would be high in mercury? Do we need to switch them to a lower mercury fish? Do they maybe need to change their diet to incorporate more chia seeds, flax seeds, walnuts, the omega-3s, or the nuts that are rich in omega-3s? All these things are predicated upon these different levels. And so that person, I would say, okay, look, you got to cut the swordfish and the tuna. You got to look for sources of mercury in your air, your water, your food, your body with amalgams in your teeth. And you have to think, okay, why are these levels high? Find the source, eliminate the source, and then find sources of the omega-3s that you're lacking in order to supplement those. And I could just go down the list. I mean, for example, beef liver. Beef liver is great for the people who have issues with maybe B12 or B6. But let's say that they're over methylated. Well, if I give that person beef liver, they may get worse because it can actually drive them into states like panic or anxiety. And then likewise,
for the common folks in plain English, methylation.
Oh, sorry. Yeah, the methylation cycle is a cycle where methyl groups are traded between different vitamins and proteins with the goal of maintaining your cellular homeostasis. Many different factors are affected by this cycle. For example, it's necessary in order to detoxify toxins from your environment by making glutathione, which is the main cellular antioxidant. It's necessary to make hormones and neurotransmitters because those methyl groups have to be attached to different biochemicals, biomolecules in order to make those things. And so it's really a very powerful system, which when it's off will affect detoxification and then also bioenergetics and energy fluxes across the cells.
And is the methylation process itself linked to leptin?
Interesting that you asked that question. So leptin is an interesting story. People who don't know. Well, for people who don't know, Jack Kruse wrote this thing called the leptin prescription years ago. That was all about light and living a circadian life with proper light cycles in order to try and optimize leptin. And he got interested in leptin because he was morbidly obese and he wanted to lose weight. And leptin is part of the hormone, let's just call it complex or system in mammals that governs how we gain and lose weight and how energy is metabolized and managed in our cells. And the leptin system is very light sensitive. And really, I don't even want to call it the leptin system because when you talk about leptin, you also have to talk about ghrelin, you have to talk about neuropeptide Y. These all, yoke into things like melatonin and serotonin and dopamine and norepinephrine, epinephrine. I mean, at the end of the day, what we're really talking about is, and really the question you asked me is, what does methylation have to do with circadian rhythms, right? And so if methylation is really a catch-all term for a process that is essential to life by driving cellular energy production and detoxification, what does that have to do with circadian biology? Is that fair?
That's right.
That's really what you asked me, right? So the answer is yes. Why? When, circadian biology, right, the idea of living your life around the day in accordance with the light cycles of nature, people have to appreciate that all light in nature is yoked to the cycles of the earth. If you live in a cold, dark place like Denmark, you also have a long, bright summer. And those long, bright days are balanced by short, dark nights, short days and dark nights in winter. And this is how seasonally breeding mammals will gain enormous amounts of weight, which is, of course, how the leptin, or that's what leptin's all about during the summer, so that they can then burn it off in the winter without starving to death.
Right. And
so
also making light intracellular.
Yeah, right. Exactly. That's the other part of the story, right? That's the other thing about methylation, right? Is that if your methylation determines the bioenergetics in your cell. Bioenergetics in your cell is all about, not only ATP and energy substrates that are physical or chemical, I should say, but energy substrates that are photonic, i.e. infrared and red light. But we're skipping ahead. So the whole idea behind, the methylation cycle and the things that people often are missing when they talk about methylation are how it's yoked to the day-night cycle. We need darkness at night in order to regenerate our body's energetics and cellular health. And the magic of melatonin is really what does that every night. So when you deprive your body of melatonin, and melatonin is made during the day by red and infrared light on the skin, as well as to a certain extent visible light from what I've read. And then it's released at night into the body after 3 to 4 hours of complete darkness. If you mess with those two key parameters by decreasing the amount of red and infrared light you absorb, and or exposing yourself to fake blue and green light at night, you will chronically deprive yourself of melatonin, which leads to a complex cascade of problems in your other neurohormonal pathways that really impact how you process nutrition. So yeah, the methylation cycle is dependent upon a normal day-night cycle, healthy sleep, healthy melatonin levels. And without that, people will get sick and gradually, lose their health no matter what they're putting into the methylation system. I've seen, patients who swear up and down that they eat a very pristine, healthy diet end up with, high homocysteine levels. What was going on with them? Well, they liked to stay up at night. Flip day-night cycle.
Yeah.
That's one reason why, heart disease is more common in people who work the night shift, just like cancer is more common in people who work the night shift. Practically all diseases are more common in people who work the night shift. This all goes back to melatonin. It all goes back to the impact of artificial light at night. And it works, at least in part, through the methylation system being deranged in these people.
And has that the result of that process, or killing or decreasing the functionality of that process, to do with the uncoupling of the mitochondria during the nighttime?
That's an interesting question, right? So how the mitochondria uncouple is all about how they're trying to balance protons and electrons across the membrane in order to optimize voltage within the mitochondria and therefore energy generation and health within the cell. And so talking about uncoupling in the context of circadian and circannual biology is, it's really interesting, but it's also very hard to quantify, or should we say, or it's hard to quantify, and it's hard to I just think it's hard to use therapeutically. And the reason I say that is because I've seen people do things to try and uncouple their mitochondria, not get better or fail to get well when they don't address other fundamental factors that indirectly drive how mitochondria can or cannot uncouple. You have to remember the body's got this really infinite intelligence in how it handles things. And we're constantly we're tempted to second guess it. We're tempted to say, oh, well, the thyroid's not producing thyroid hormone. Therefore, the answer is to give the body thyroid hormone. Well, wait a minute. What if the thyroid doesn't have the nutrients necessary to make thyroid hormone? What if the nutritional pathways, metabolic pathways that are driven or turned on by thyroid hormone don't have the necessary metabolites to fuel them? What if the body is downregulating thyroid hormone in order to prevent the turn on of these pathways that the body's not ready to fuel? I'm not telling people to go out and stop their thyroid hormone, because I put people on thyroid hormone all the time. But if we just have a skin deep approach to medicine of, oh, your thyroid hormone is low, therefore we will give you more thyroid hormone, you miss a lot of stuff. And those people get worse and they don't know why. And eventually you run into issues with their thyroid hormone. You can't balance their symptoms with thyroid hormone alone, which of course implies that the problem is not truly a thyroid problem. It's some other process that you're missing.
But with your protocol, I guess you try to find those missing links.
Well, that is the idea, right? But it's a tricky thing, because your body's a big place. If you think about it, most of this testing I'm doing is looking at urine and blood. And in your urine, you're seeing really, I do a first morning void collection with the labs I do for nutrition initially. And that first morning void is really reflective of the circulating compounds in your bloodstream overnight, because they're going through the kidney, they're getting filtered out, they're accumulating in your bladder. There's a certain amount of, breakdown that happens there. And then you get up, you void, you capture it. And then we see basically what was going on in your bloodstream overnight. You'll also get a blood draw with that, right? Well, if your urine is the derivative of your blood and your blood draw is, a snapshot of where your blood is right now, that tells me nothing about the rest of your body.
Exactly.
And when you get into the actual numbers behind what's in the body, right, you could have a normal serum magnesium, totally normal, and you could have a radically low total body magnesium. Why? The blood is the last place that the body is going to tolerate a deficiency of a nutrient, because it's at that point that the body begins to actually run into life-threatening problems. The blood is the sort of, shall we say, it is the it's like the 5-yard line on an American football field. Like once they get past that 5-yard line, you have very little room to beat them off and win and come back. Right. And that's why, derangements in your blood chemistry are such urgent matters that need to be addressed. But you can have two people who have, radically different levels of trace elements or vitamins within their total body, have similar levels in their blood. That's why I don't use, for a lot of things I measure, I don't use blood levels of the actual nutrient. I will use a surrogate marker, like say a kynureninic acid is a great marker for B6 deficiency. That denotes that the patient's got a global B6 deficiency within their body. And so
that way you can also measure, you get a better viewpoint of what's happening inside the cell.
That's exactly right. Yes. You have a better idea of what's happening inside the cell. And within the blood, you can check RBC levels, red blood cell levels, or white blood cell levels of different nutrients in order to understand, well, what's actually inside of these cells, not just in the serum. That's a better test for things like magnesium and potassium. But it is also still not going to tell you what's in the patient's total body. You have to really do serial lab measurements in order to determine that. You have to track their diet. You have to understand what their losses are as well, if you really want to get to the bottom of what they actually need.
And still, it is just a measurement of a moment. And
that's right.
That's also, I think, a very important factor when you're testing people on markers.
Right. And that's the thing about, what I do now with the way I integrate, quantum biology, quantum medicine, whatever you want to call it. You'll see these big shifts in people's physiology that are going to show up in their labs, but they're fundamentally being driven by problems in their environment that are of a bioenergetic nature, right?
That's also a very, very interesting word, which I also want to link to the bioenergetic sphere of posture, facial expression. What else are you looking for when, for instance, let's say I have an autoimmune disease, I walk into your office. A big shout out to today's sponsor, Ergomax. Innovative, scientifically based nutritional supplements for people who care about their health. Use the code Matthijs10 at the checkout for your 10% discount. What exactly, besides from the lab testing, is what you're looking for when you see a person coming in?
Number one, always question the diagnosis. Does the patient actually have an autoimmune disease? How do we know that? One of the funny things to me about the way that the health infosphere has shaped people's interactions with their clinicians is that they're not coming in and saying, I have abdominal pain. They come in and they say, when I eat gluten, I get inflammation. That's a very vague thing. So I'll always stop them. I say, what does that mean? Because it's different for everybody. I want to know, are you having bloating? Do you have abdominal pain? Where is the pain? When does it come on? What is it resolved or improved by? What is it worsened by? What do you do when you get it? Is there any kind of change when you get it during, say, for a woman, her time of the month, for seasons of the year, for different dietary things that they're doing alongside it? So all these different things are factors we have to look at when we are looking for, somebody who's coming in with, say, an autoimmune issue. Because a lot of autoimmunity is this, and the conventional diagnoses of autoimmunity basically require you to have some degree of autoantibody production. But what's happened is that people have gotten into this habit of thinking, okay, well, I have these inflammatory symptoms, therefore I must have an autoimmune process. Well, you may not have an autoimmune process at all. You may have something completely different. You may have, say, a occult infection with something that in your GI tract that needs to be treated with an antibiotic, and then these things will go away. What's interesting about that is that when you look at the mechanisms behind autoimmune diseases, and there's a reason I reach for that example, it's the most common one in my practice. What you'll see is that bugs, bacteria, fungi, et cetera, will try to disguise themselves using our native proteins as cover. They'll try to look like our own tissues. If the immune system is not smart enough and it gets dumb or dumber, the more you poison it with toxins, heavy metals and particulate matter, hydrocarbons, toxic chemicals, whatever, endocrine disrupting compounds, all the things people read about in health and wellness, infosphere, right? The dumber your immune system then gets. It also gets dumber if you malnourish it. You got a big imbalance in certain nutrients. You're taking in too much copper. You're taking in too little zinc. Any of those things can make it worse. What happens when it gets dumb is that it loses the ability to really differentiate readily between, different pathogens and you. And so the pathogens are able to disguise themselves because your immune system is not able to really resolve what they are. And that then can lead to people cross-reacting between a pathogen and their own native body tissues. That's why so many people will go on an antibiotic for something, whatever, skin infection like cellulitis or syphilis, a routine thing for just like a dental procedure that they may have or a dental abscess. They may go on an antibiotic for something like a bad gallbladder that's got infected. I mean, whatever. And they'll say, what the funny thing is my joint pain got better. And when you look at, studies of these joints and people who have these weird, arthritis syndromes, you'll see that a lot of them have positive PCR testing for the components of bacteria in their joints, which, begs the question, is the bacteria there? Or is the bacterial antigen there driving this process? And then how do you get the bacteria out? The answer is fix the immune system, and a lot of these problems go away. Sometimes you can get to a pathogen in a place like the GI tract with a simple oral antibiotic, which can work wonders for people. But sometimes you don't have to, because if you get the immune system back on track, it should do its job.
So I think one of the first things you said is always question the diagnose. I think
always.
I think that's a very, very, very very important question to ask. Mm-hmm. And so how do we start with repairing one's immune system?
It really cuts to the heart of the statement you just made, which is questioning the diagnosis. What is a diagnosis? Diagnoses are kind of these ridiculous labels we give on very different diseases. Two people can have IBS, irritable bowel syndrome, and have radically different presentations. Why does anyone think that those two people have the same disease? They have a constellation of symptoms that carry some commonality, right?
Right. So it's just a state of being. And the other one is highly energetic, and the other one is not so very is low energetic, which results in yada yada yada.
I mean, yeah, however you want to put it. I mean, they're similar pathologies with different details. Like, let me give you an example. Let's say two patients have the exact same symptoms, and they grow out the same nasty infectious pathogen or parasite, bug or bacteria, whatever, on their stool culture. But one of them has a resistant antibiotic or antibiotic resistant bacteria strain, and the other one doesn't. You give them the same treatment and they get a different outcome because you didn't account for the the possibility of resistance of one of the strains, right? So diagnoses, I find I work with them less and less and less and less and less. It's not that I don't pay attention to them because they denote useful clinical information. But at the end of the day, whenever there is a disease, it is the consequence of an imbalance in the patient's diet, lifestyle, environment, or mindset. There's nothing beyond those. There's nothing that can affect your health that doesn't fall into one of those categories or cross over between them, right? Mm-hmm. And so when we're looking at causes of disease, this whole idea of, gluten causes my bloating or gluten causes my abdominal pain. Well, wait a minute. Why? Why does gluten cause you to have abdominal pain or bloating? Oh, well, I have celiac disease. So I have an autoimmune disease, and I know it's positive on my antibody level testing and whatever. And I know that when I eat gluten, I get sick, right? Okay, fair enough. What happens if you avoid gluten for 6 months and radically change your lifestyle and environment and your microbiome? Is it possible that those immune markers would go away and the disease would be in, let's call it, remission? Mm-hmm. Well, why not? Right? But modern medicine, conventional medicine, doesn't deal in attempting to cure diseases. It just engages in managing them, which is
more focused towards the treatment of the symptom itself. rather than zooming out and seeing, all right, this is happening over here and here. And
Right.
it's like a domino
Right.
clock falling.
And not taking an approach to the case in which we say, okay, sure, you've got these autoantibodies and you're not able to tolerate gluten, and that's all well and good. And you should certainly continue to avoid that because it's obvious that it will make you sick. But, why don't, rural tribes in the middle of nowhere get celiac disease? They don't live under fake light. They don't eat fake food. They don't have social media. They don't listen to the mainstream news. What do? They live under the sun. They're connected to the earth. They eat a natural, whole foods, seasonal diet. And they contend with a lot of other pressures and stresses that we don't have, like intestinal worms and parasites and, significant traumatic injuries and overuse injuries and a lot of things that we can banish practically at will and that we've really edited out of life with modern food safety and processing and, our fancy homes and shoes and basic things we take for granted, right? But when you look at how people are living, these stressors and environmental factors like EMF, artificial light, are over time accumulating a stress on the organism that then eventually results in critical physiologic processes like being able to tolerate and digest gluten breaking down.
Right. So it's due to all these chronic stresses from EMF to artificial lighting to the way you adapted to stress in your youth and not being conscious of the environment triggering you of that adaptivity is eventually using all the building blocks for cortisol instead of all the other functions that your body needs to repair. And it needs other hormones besides from building cortisol all day because you're getting stressed in a chronic manner.
Yeah, right. And you're just exhausting your resources, making all these things to respond to all these stressors without necessarily nourishing yourself in the proper way to resupply those nutrients. So and it's interesting when you look at all the nutrients that people tend to be, when you look at any nutrient, they all have a relationship with light. And it's really struck me looking at levels of nutrients in different patients that, what if, artificial light at night is driving nutritional deficiencies in people? Because to respond to the light, you have to create things like hormones and neurotransmitters. So it stands to reason you could run out of those things if you used artificial light in any capacity actually to excess.
So you were talking a little bit about your protocol and the measurements you use. So you were mentioning lifestyle, diet, mindset. Where do we start when someone would work with you?
Yeah. So when people work with me, we start with an initial comprehensive case review in which we go over everything of relevance to their case. And it's 90 minutes. And we get into, I want to know what their daily routine is. I want to know what their current environment is. Typically, I'll go in on like Google Maps and I'll look at their address. We'll talk about what we see, a cell tower over there, high tension power lines over
so
there.
You dive into Google Maps and then you click on the real life view?
Absolutely. Because, you just don't, there's so much to unpack about someone's environment and their routine, because they often don't realize why they're doing certain things. And when you start to look at their environment, they begin to realize, when you have the information that I have, you begin to put together why they do the things they do and why they feel a certain way with things that they do.
So can you give a nice example of somebody you helped with a Google Maps mirror you gave somebody?
Oh, sure. I had somebody told me they were selling their house and buying, they just bought a lot and they were building a new one. And we pulled up the new address and I said, there's a high tension power line right there. And he was like, well, how far do I want to be from it? I said, look, you need to get these meters. You need to go out there. You need to test the levels. If the magnetic fields are in an acceptable range, then that's okay. You're going to want to measure it at multiple times of day because the amount of power being transmitted down those lines is going to vary radically based on time of day. And it may change from year to year because if you put more people downstream from the high tension power lines, there's more demand, there's more power, there's more magnetic flux. And that changes during the day because people, may or may not be home, may or may not be using as much light. may or may not be having different devices on. So the power used in the grid radically varies over the course of the day. So that's one example, right? You might also find somebody who's feeling horribly socially isolated. You're talking about where they live, and they say, "Oh, I live in a nice little, house out in the country." And you look out in the country, and you say, "Okay, so you live out in the country. You're 45 minutes from the nearest coffee shop. You're depressed and anxious, and you're in your head all the time. Has it occurred to you that maybe you need some more socialization in order to feel normal?"
And then they're silent.
Right. Yeah.
So, all right, we have a cell tower. I live on a country house.
Yeah.
You give me the mirror, and from then, where do you go from that on?
You mean after my initial appointment with people?
Yeah.
We talk about how we can work together. We talk about what labs I think they need in order to quantify their, unique physiology and their current physical state. I like to tell them to get some basics, vital signs, blood pressure, pulse. A lot of people have no idea what their vital signs are. And if they do know, they've been told by a doctor who's taking it once every 6 months. It's amazing because you find amazing things when you test people's vital signs at different times of day, under different circumstances. You give them insight into what's going on with them that they really have never thought to bother to find. So you get that information, you get the lab testing, you implement changes, and you walk them through how to create a optimal diet, lifestyle, environment, and you get into their mindset as well, and they get better.
So I think that's also very interesting to hear what an optimal health and lifestyle and mindset looks by your vision. But before we go to that part, do you happen to have a clear definition of health?
Great question. It's a great question because really we tend to look at health in sort of a vague way. Right. And many people think of it as being the absence of symptoms. But what's funny about that is I was struck over the course of my career by the number of patients who would come in who thought that they were healthy. I mean, patients would come into the hospital having a heart attack who had just run a 5K the week before. And they say, well, wait a minute. I was a highly paid professional up until I retired 2 years ago. I thought I always ate a healthy diet. I'm able to run, long distances. And you're telling me that I have a bad heart? And they're shocked, absolutely shocked. So health is not so much the absence of disease. It is the optimal functioning of the body's organs, tissues, and systems above and beyond, the baseline necessary to just sustain life. And it's interesting. My thoughts on this have actually been very much shaped by reading I've done and listening to special forces soldiers, because they are the people who have to function at the highest level. But it's interesting, they're not like professional athletes, and the professional athletes need to be able to, like Usain Bolt doesn't care what his deadlift is so long as his sprinting time is really low, right? So he's looking to maximize maximize one metric of his performance. People who are in special forces have to have a well-rounded ability to deal with stress. They also have to have a mindset that is extremely resilient. When you think about how much control athletes have over their game, it's a lot. I mean, they're stepping onto the same court, made out of the same material, in the same shoes, wearing the same clothes, facing off against different teams, but people with the same skill sets who they've heard about, read about, learned about, played against maybe even before. It's a very controlled environment. When you're dealing with a military situation, you have no idea where you're going to be deployed. You could be in Antarctica. You could be in, sub-Saharan Africa. It could be very hot. It could be very cold. It could be the winter. It could be the summer. You could be in a long day cycle. You could be in a short day cycle. You could have to operate underwater. You could have to operate at a high altitude. So what they are focused on is creating a extremely resilient physique. They're not interested in being able to squat, deadlift, max bench the most. They're not interested in being the fastest runners. They're interested in being extremely resilient, well-rounded, and able to adapt. And that really, when I read that in this book I was reading about it called Building the Elite, which is a great book. It's the one I recommend to my patients if they just want to read about the mindset that it takes to be optimally healthy. You have to have a balanced view of your nature and your biology. And you have to, your goal in creating your health, at least for me with my patients. And obviously this changes, right? If somebody comes to me and says, hey, I want to max out my deadlift, or I want to, have the fastest, 100-meter time, we obviously focus on that. But in general, what you want to do is you want to expand your range of potential operations by supporting all of your systems, by creating a healthy environment, so that you can do pretty much anything you want without being adversely impacted by it for a prolonged period of time.
Right.
Everyone who works out is going to have to recover. Everyone who undergoes any kind of stress is going to have to adapt to it. But you want to be able to go out and have a slice of cheesecake and drink a beer and, stay up late at night and do these things that people regard as stressful and unhealthy, not for the sake of doing them, but because when you're really healthy, you can do whatever you want.
Right.
So that's my metric for health.
I'm very curious about the definition. One of a good friend of mine defines health. Ruud Elvers is his name, and he has been studying the human self more than 40 years long. And he is a perfect bridge between spirituality and science itself. And from quantum biology, he's a brilliant mind. But let me go to his definition of health. Health is a state of highly energetic being, rooted in electromagnetism, whose adaptability results from self-maintenance and self-healing as its forms of expression. I think, like you said, being well-rounded, and whether it's cold or heat or cheesecake or celery it doesn't matter, because you have enough energy to adapt to self-maintain your structure and heal your own system when it's needed.
Right.
Yeah. All right. So then we I can agree on that.
Totally.
That one. So where were we? I think you were telling about.
We're talking about health, what it is.
That's true. So you of course you also giving lots of knowledge to your patients as well, like the book you mentioned. Is it, you think, a fundamental part for people to understand before they act?
Great question. Yeah, I mean, really, people need to understand the basic mechanisms behind their biology if they're going to be healthy. When they don't understand the mechanisms, they misapply therapeutics. Like, for example, they may hear that the more sun they get, the lower their risk of death. And that's technically true, but you run into other problems. So, for example, you could end up with a horrible skin cancer. You could end up with really ugly photoaging. And the question is, do you get a point of diminishing returns when you get more and more and more and more light onto your skin? That's definitely the case. And, when is going inside or putting on sunscreen the right answer? The literature is pretty clear that you should not sunburn, because that's really bad for your skin. It creates photoaging. It increases your risk of having cancers. It's going to result in unsightly skin that needs to be medically managed somehow. And that is just going to be, people don't like to look bad. That's a real physiological stress on people. And, it's, people want it to just be, they don't want to be bothered by their aesthetics, but there's a very fundamental level of our physiology that's bothered by a poor appearance, an appearance that we aren't satisfied with. So anyway, they need to understand the context. And that's varied. What's your skin type? Do you burn? Do you not burn? What latitude are you at? How healthy and robust are you? How do you feel when you're exposed to light? Do you maybe need different frequencies that are in sunlight? So I try to cover all the principles that govern those decisions with my patients based on their unique context. And the way that obviously I tailor that. The answers in the talk that I give to somebody in, Barrow, Alaska is not going to be the same as the talk I give to somebody in Quito, Ecuador, because they have radically different light environments, not only based on latitude, but also based on altitude. And then you have other factors. Do they work the night shift? Are they an office worker? Do they need to be on a computer screen all day? Are they maybe somebody who works outside a lot of the time? All of these are different factors that need to be considered.
And what do you think are the most simple variables that are most and easy to understand for people?
Wow, the most easiest factors in health to understand would certainly be number one, a naturalistic lighting environment is essential for health. I'm often surprised by how complicated people want to make their lighting environment and how complicated they want to make the basics of light and health. So when we look at nature, right, we have a bright day and we have a dark night. And we have a virtual absence of blue and green light at night, with the exception of the moon and starlight. And we have extremely bright light during the day. And so what do we need to be healthy? We need bright light during the day and we need darkness at night. And you also don't want to just have visible light only. You want to have infrared light in your environment. That means that I use incandescent bulbs wherever possible. It means that I am getting out into the sunlight to get some of that infrared light. And it means that I'm avoiding LED and CFL lights as possible. And when I do have an exposure to a blue or green or visible only light, I'm trying to balance it with an extra amount of time in front of a red or infrared photobiomodulation light. So that right there in 5 minutes, took me like a couple of years of reading about light obsessively to come up with. And people want to make that complicated, and it's not complicated. The next thing would be, our water supplies are horribly contaminated with all kinds of chemicals. And it's been amazing to me to see people's levels of arsenic, levels of, mostly arsenic actually from groundwater. I can't think of somebody whose well has been contaminated by mercury or lead or aluminum. Although the aluminum I'll see in people's labs will come from cans that they're drinking out of, or it's a total body burden, right, from past vaccines or past
the water you're using in your shower, the water if you're drinking tap water, of course.
Right, exactly. And so they need to be filtering their water because
deodorant.
Well, not the aluminum-based deodorants. Right. There's tons of other options out there now. But putting aluminum on your skin is just, you're massively increasing your aluminum burden over the course of your life, right? Because a certain amount of it will be absorbed. So people need pure water.
Familiar with the work of Dr. David Minkoff?
Minkoff? Yeah, I know about Minkoff. Why?
I this morning I was listening to Paul Chek interviewing the man, and
really,
Paul was talking about his metal-free diet, I think. So I still have 106 minutes left.
Paul has a metal-free diet?
No, he was talking about the diet. Yeah, he used it himself as well, Paul Chek, and he found out about it. I don't exactly remember how he found out, but it led to Dr. David Minkoff. And I think since we're talking about some metals, I still have to research his work, but I'm not sure. Maybe if you already use it and if you're more familiar with his work. And
well, when you see a heavy metal in the patient's body, you have to ask the question: how did it get there? Where is it going? How do we get rid of it optimally, right? So let's say it's mercury. It's almost always a high tuna swordfish diet, some combination of that, a broken methylation or detoxification pathway for any number of reasons, and or mercury amalgams. Now, cadmium you can get from air pollution. You can get it from some electronics or industrial exposures. And arsenic, groundwater, rice, other foods. There's a list. I don't have it on hand. But there's a list of different foods that are higher in arsenic, and it's going to depend on the soil they're grown in, correct? Because if you grow it in a low arsenic soil, it's not going to accumulate arsenic. But if you grow it in high arsenic soil, it's really going to be high in arsenic because it does bioaccumulate. Rice bioaccumulates arsenic. So you have to ask where it's coming from. Is it in the patient's diet? Are there foods they need to avoid, right? And then you got to ask, well, where's it going? If the patient has a newly elevated level, but they haven't introduced anything new in their diet, and they're feeling better than ever because you fixed a bunch of stuff in their environment and their diet and their lifestyle, well, it begs the question, is the body mobilizing this heavy metal in order to eliminate it so that the body doesn't have to deal with it anymore? That's what I consider to be the answer to that question. I don't put people on a metal-free diet because, I'm telling them to eat sources I'm telling them to eat a diet that's low in toxic metals anyway. And more often than not, I'm finding that those levels are related to not something in their diet, but their air or their water quality, which we can mitigate with things like air and water filters.
Mm-hmm. And what do you think of the most brilliant way of detoxification? Is that just alone sunlight hitting the skin on its own?
I would have to say that if I had to pick one for the rest of my life for me to use, both for myself and for my patients, it would be sauna. Sauna, yep. Because sauna does two things. One, it increases the amount of blood that's flowing through your kidneys, which are naturally going to filter toxins. Mm-hmm. And two, it's using your skin in order to directly eliminate toxins. And you can overuse sauna and exhaust the body's supplies of energy, but you can also add more energy back into that system and use that sauna in order to detoxify over and over and over and over again. Mm-hmm. And this avoids problems that people can actually run into with things like binders and chelating agents, because what people don't realize is that a lot of the time they're using those agents to pull toxins out of tissues, and the body's not ready to eliminate them. You haven't fixed nutritional deficiencies. You haven't fixed circadian rhythm problems. You haven't fixed EMF problems. I mean, I just sort of shake my head at all these practitioners who are running around without ever testing the EMF environment of their patients, because I know that a lot of the pathology they're trying to chase with chelation and, fasting and, drugs, surgeries, supplements, herbs are being driven by electromagnetic radiations and energies in the environment that are just going unappreciated. And it's just amazing to see how people do when you actually measure and fix those things.
Do you have a regular name of a measurement device that you would advise somebody to buy and use or rent?
I like the Electrosmog MK5 kit, I think it's what it's called. It's from Safe Living Technologies. It's SLT.co. It's a company based out of Canada. They have a really nice and simple RF meter that doesn't give you a lot of quantification, but it does give you a basic reading. And then it comes with a nice electrical and magnetic field reader. And that whole thing comes in a nice kit that you can carry around like a little laptop briefcase.
Right.
And it's very handy. I mean, it will diagnose most of the problems you're going to run into in your home environment.
So what do you make sure in your own environment where you live? To give us an example.
Right. So the house I picked is in a neighborhood with large lots with small houses, which means there's not going to be the same density of EMF that you might otherwise expect. There's a lot of tree coverage. There are no visible cell towers. My house right now, I'm renting. I'm about to move to Florida. It's got aluminum siding, which is a natural shielding material. And it's on a single concrete slab. So the house is grounded. And the smart meter I had deactivated by the electrical company, so it's not emitting any RF. I never use the microwave. And I only turn on the circuits that I really need in order to run the appliances and technology that I'm using at the time. So right now, I think I have 4 breakers on in the whole house. When I go to sleep, those all go off. And, it may just be in my head, but when I turn those off at night, there's just this feeling that I get like the whole house is quieter in this odd way. And it's funny because it seems like people, I'm not the only person I've heard say that. I'll never forget having a friend of mine who was living in LA. God only knows why Alden did this. He runs a superfood energy company called Red, which people should check out. It's a really delicious energy bar. And he decided to buy a military grade vehicle that was EMP proof. Now, when you shut the door, for people who don't know, EMPs or electromagnetic pulses are large electromagnetic events that, if they happen in the atmosphere, can destabilize the power grid and cause massive blackouts. These are, in a sort of doomsday scenario, the kind of thing that could cause, society to end as we know it, and for there to be, no more human civilization on Earth. There are low likelihood events, but they can still happen. So the military is aware of this, and so they have a lot of vehicles and material that is EMP proof. The other reason to EMP proof something is you're also shielding it from any kind of wireless probing, right? So people hear about like the U.S. Moscow embassy attacks back in the Cold War, or the recent attacks on the U.S. embassy in Havana. If you're being attacked by electromagnetic frequencies like radio or microwave radiation, you can put up shielding, ground it, and mitigate the effects. Which is why it's, of course, so ridiculous what governments and cell companies are telling us, that these technologies are totally harmless, right? But anyway, he bought this EMP-proof vehicle, and he was living in LA at the time, and I was telling him about all this research I was doing on the clinical applications of avoiding and mitigating EMF. He said, yeah, it's the darndest thing. When I close the door on my EMP-proof vehicle, it's like there's this strange calm that I get. I don't know what it is. Of course, he's saying this in one of the most EMF-polluted cities on Earth. And I just thought, Alden, you're making your EMF environment totally silent all at once just by shutting a door. It sounds great.
Yeah. Is it also not a possibility that when the EMF comes into the vehicle, it stays in the vehicle because it's so incredibly...
Yeah, it depends on how you do the shielding and how you ground it.
All right.
Because if you're dealing with a vehicle or with anything, right? Because you could put a Faraday cage over your bed. If you don't ground it properly, it's going to turn into an antenna.
Right. Yeah.
But the importance of that, the relevance of that, depends upon the intensity of the field that it's in. So, if you park an EMP-proof vehicle next to a cell tower and it's in a hugely powerful field, that could create an issue. On the other hand, you can ground the vehicle very easily. And then, on the other hand, right, you could arguably insulate it in such a way that you weren't creating a giant antenna out of your Faraday cage. But that's beyond me. I'm just a simple country doctor.
All right. And how does these subjects live with colleagues or old study mates that you still are in contact with?
Can you repeat that question?
Oh, if these subjects live amongst colleagues of yours and old...
My conventional colleagues think I'm a nut.
Oh, they think you're a nut.
They think I'm crazy, yeah, which is fine with me because I look at the results that they're getting and I don't care what they think. Their approach to medicine is stupid. And I just am not going to make any bones about that. I mean, how the American medical system is taken seriously when it consumes a quarter of what our nation, one of the wealthiest on earth, produces and delivers mediocre results is beyond me. I mean, at this point, modern medicine is just an emperor with no clothes. And people are waking up to the fact that, all this medication they're taking, all these treatments they're submitting themselves to, all these, routine, invasive, supposedly science-based interventions are not making them healthy. Mm. And their healthcare insurance premiums are going up, and every year they're spending more money on their insurance, and they're always meeting their deductible, and they have an endless number of specialists and other sub-specialists that they have to go see. And they go through this song and dance. And probably, if I had to estimate, the average patient who winds up finally seeking alternative care after having looked for regular care has spent months and even years traveling to see conventional doctors and not getting good answers. Mm-hmm. And that's where truly natural functional medicine shines, because you begin to look at the things that are actually making people sick and getting rid of them and restoring natural health building, resiliency building nutrition. And when I say nutrition, it's a funny word. People don't appreciate that nutrition or nourishment, or to nourish. The verb to nourish means to raise up in a good way.
Right. Yeah.
It actually doesn't have anything to do with what you eat. It's just how you're being raised or how you're being treated. And so, your nutrition, comes down to the light you're living under, the electromagnetic frequencies you're being exposed to, the air you're breathing, the water you're drinking, what you're putting on your skin, what you're being exposed to, through your eyes as far as light. It's also about media. What kind of content are you consuming? What kind of music are you listening to?
Mm-hmm.
And then, not to mention, what are you putting in your mouth and into your digestive tract?
A big shout out to today's sponsor, Ergomax. Innovative, scientifically based nutritional supplements for people who care about their health. Use the code Matthijs10 at the checkout for your 10% discount. All right. And what else from the regular medicine world in the States is grinding your gears at the moment?
I mean, where do I even start? It's just, I'll just say that the current unpleasantness, viral pandemics tend to last 12 to 18 months historically. And we're being told that the current situation is an exception to this ironclad historical rule. No one should fall for that.
Mm. So how maybe you can talk us a little bit or speed us up on the whole presidential puppet, as far as most people I know in the Netherlands think of Biden as an Alzheimer puppet. Do you have some thoughts on that?
Yeah, I mean, I think
maybe he sleeps with his router on, or
yeah, his mental state is concerning, and the fact that people want to pretend it's not is just pathetic. The truth is that the corporations who are really trying to run the world cannot afford to let the little people like you and me get to thinking that maybe they shouldn't be in charge. And that's what all this control is about. It's about how do we get these little people to not try and throw off the yoke of our oppression. Because when you look at the shell game that is the global economy, it's really driving the disease that we see. Every patient I have who's got a medical problem that's being created by things in their environment has been sold those things. And really, they get sold on it by some combination of, soft government coercion and clever marketing that appeals to short-sighted thinking, right? And that's why, the world has gone from really being, we were so healthy just a few generations ago. Not to mention that, the amount of wealth that was being generated, we had a very robust, powerful global economy that was built on actually making stuff. And what's interesting about that is that even at that time, back in the 1960s, 70s, we were already working on cleaning up the environment so that we weren't just producing things as we had in the Industrial Revolution in a way that really killed people, frankly, but that also even sustained or prolonged life. And right now, the top offenders for the worst people in the world are the people in these corporations who are trying to cover up the effects of their product on the public health. Because if tomorrow you pulled the products that make up probably 90% of consumer spending from the shelves, would you wreck the global economy? Yeah, of course you would. But if people stopped using all that crap and started going out and, spending time at the beach in their backyard, playing fetch with their dog, doing the things that they're not doing now to instead spend time on social media, doing things like prepping their own food from scratch rather than settling for the convenience of fast or processed food, the world's medical problems would disappear.
Mm-hmm. Yeah, I think that comes down to if you get back to health, like pure health is decentralized. Nature is free, sunlight is free. If you have the skills to fish, to hunt, to produce your own crops, that's free.
Right.
You just need time, skill, and energy.
Right.
And I think another important factor is to lose the compartmentalized view. Like we have in medicine as well. We have a heart, so we have a heart surgeon or a heart doctor. We have a skin, we have a dermatologist.
Right. The reductionist logic or a reductionist approach, it's very flawed, especially in health.
Yeah. Yeah. So to maybe some interesting tools about on stress. I am very curious because you also mentioned mindset.
Yeah.
What are the factors that you use when it comes down to stress? Because of course stress
Yeah.
happens on many levels.
Yeah. Yeah. So I teach patients a certain amount of NLP, neuro-linguistic programming, in order to help them get out of their own heads.
Mm-hmm.
It's usually the problem they're in or that they have. The main thing that people coming to me have is that they're in their head all the time about all the stuff in their environment that may kill them. They walk they walk into the grocery store and they see the croissant. They think, oh no, the croissant, if I eat it, I will be sick. And they walk past the almonds in the nut aisle and they think, oh no, the oxalates will make me sick. They go to the dairy aisle. Oh my gosh, the dairy, can't have that. That would,
Right.
Absolutely put me out of commission for the next 48
they're always
hours,
thinking from pathology.
Right. And so I don't begrudge them being aware of things that will make them feel poorly. Obviously, I'm not trying to disempower them. I'm trying to empower them with the perspective that the more they dwell on those things, the worse they're going to make their problems.
Right. Yeah.
It's beyond just the grocery store. It's the cell tower on their street. It's the Wi-Fi router that their roommate refuses to unplug. It's the Wi-Fi router their neighbor in their neighboring condo refuses to unplug. I mean, there's all these different things that we've got, and you have to be aware of what's going to drain your body's resources and battery. And then you've also got to be able to say, you know what, that stress is there. There may come a time when I have to cut that thing out of my life in order to really achieve the health and well-being that I want to achieve. But I got this, and this that I'm going to do before that, and we'll see how far that gets me. I don't deal with EMF up front with my cases. I get to it after a matter of months for a couple of reasons. But the foremost of them being that there's much more fundamental stuff to be dealt with before you get into EMF. There are exceptions to that. If somebody opens the conversation with, hi, my name is Joe, and I sleep on top of an inverter for a large array of solar panels on my farm in Arizona, and I sleep next to a smart meter, we're going to start with EMF because I know I'm not going to make any progress until that guy is not in that environment. But it can be very simple fixes, right? Because I can tell that guy, okay, look, your EMF environment in that room without any meters is probably terrible. It may be the source of all your problems. So you need to sleep on the other side of the house. And when I get pushback for perspective like that, and they're like, well, I don't know. It's because frankly, when people push back on you for a therapeutic opinion, what they're really telling you is that's more inconvenient than I want it to be. It's not being willing to consider that might be the problem. I say, look, do an experiment. Sleep on the other side of your house for a week. Let me know how you feel. Or better, take a vacation for a week and let me know how you feel, preferably to some place that's going to be low EMF. Book a farmhouse in the middle of nowhere, unplug the Wi-Fi router, just relax, read some books, catch up with some friends in person, over a beer, and then tell me how you feel. Because you just cannot fix problems with EMF or light or sound or air or water or food without with other things. You can mitigate them. You can maybe get some therapeutic benefit, but you can't fundamentally fix them.
Yeah, clear. And what are topics today which are on your mind that you're working yourself on?
Right now, that's a great question. Right now, I am number one thing I've been working on has definitely been my breathing mechanics. I got into Patrick McKeown's work almost a year ago, and I've been working on that slowly but surely to improve my breathing mechanics. But I know I'm not there yet because I'm still snoring.
All right. Do you have flat feet?
No.
All right. Do you know functional patterns?
I'm aware of functional patterns, yeah.
What is your opinion on FP?
I don't know enough about it to have an opinion.
All right.
Yeah.
Do you have some
I've heard good things.
Do you have direct experience with FP yourself?
Oh, no, not at all.
All right.
I've just heard about it through
All
the
right.
grapevine.
All right. Yeah. Well, I can highly advise you to see a practitioner with a minimum of level 2.
Cool.
I have to give you a tiny background of my own story. 9 years ago, I stepped into a hole during football practice, and my knee snapped back. So I lost the capacity to put weight on my left knee, which resulted in seeing more than 14 physiotherapists, 2 chiropractors, knee surgery, podiatrists, but it did not help at all, which led to depression in 5 years. And from that moment on, I by luck, I found somebody who introduced me to something alternative, which helped me during that time. And from that moment on, I saw Wim Hof, and after that weekend, my depression vanished from just breathing and cold exposure. And I kept trying to speak to people who seemed to trying to solve the puzzle by fixing problems instead of treating symptoms all the time.
Mhm.
And getting a better view on and using evolution and fundamentals as the base for somebody to heal. And functional medicine has been one of those modalities which eventually I had chronic shoulder pain, I had chronic knee pain, but they also had to do for very, very large part to mental stuff.
Yeah, the
Which
psychosomatic. It's amazing what the mind
yes,
can do.
absolutely.
It's actually truly, people do not really want to believe what the mind can do. That's actually the craziest thing to me about COVID, the more I think about it, is that when you tell people en masse they're going to get sick, to what degree can you make them sick?
If you tell them they get sick.
Yeah. I mean, if you tell them that they're going to get sick, to what degree can you make them worse? If you tell them that their next cold may be the one that kills them, will you not make that cold worse because their expectation is that it will make them worse?
Of course, yeah.
This is why the media is so dangerous. They're so dangerous.
I completely agree. It's and I think going back to what you were saying, talking about NLP, if you're focused on something, you will always attract more of it and experience more of it. And one of the things I tell in my workshops when we do a Wim Hof method workshop is, when you're focused upon cold all the time, your balls will freeze off. Just focus on a tree, focus on a bird, focus on your breath, and you'll be fine. You just have to go through it for a while, trying not to die, and then you'll manage. Your body is brilliant. It's built. It's an incredibly resistant piece of
It's
mechanics.
amazing. Yeah.
But going back to the FP, after the psychosomatic stuff, which I learned lots of from bioenergetics, from Alexander Lowen, Wilhelm Reich, Freud, and John Sarno, Byron Katie.
Gotta read Sauna.
They all, you need the knowledge to see all the pieces of the puzzle, then work on them. Yeah. And plant medicine also really helped me to get rid of stuff, to finally experience self-love. TRE has been one of my golden nuggets from Dr.
I've heard about that too. Yeah.
And sorry,
I gotta run.
Oh, you gotta run. All right. Go. All right. Well, then we finish it up. FP is awesome.
Thanks. I'll check it out.
The last couple of questions is, if we call 5 of your best friends and we ask them what is Dr. Leland Stillman's superpower, and they all have to be unanimously agreeing upon that superpower, what would it be?
That's a great question. I don't know. I have no idea. Is reading obsessively about things a superpower?
I guess so.
That was what it would be.
All right. Readingly, obsessively. The best and worst day of your life?
Oh, man. The best day of my life would probably have to be the the day I realized just how good balanced protocol really was. And I couldn't tell you what that day was. The worst day of my life would have been when I had a falling out with a mentor of mine that was very difficult for me to handle, but there was an important milestone on my trip to, really coming to terms with the dark side of natural medicine, which is the hucksterism, snake oil, nonsense, over-promising and under-delivering side of the, shall we say, profession.
All right. Then we have a name for it in Dutch, but I can figure out the English name. One of the last questions. If I would be handing you a magic phone and you would be able to call your 21-year-old self, what advice?
Okay, 21. Okay, listen. I don't know how to answer that question, because all the hard knocks I took getting to where I am at ended up getting me where I'm at. And this is definitely the best I've ever been.
So just hang up the phone.
I think if I had to really pick a piece of advice, you know what Winston Churchill said about going through hell?
No?
He said, if you're going through hell, keep going.
All right. And if you should give the rest of the world population that is with the age of 21, that's the advice you would give?
Yeah, because being 21 right now is not easy. Global economy is, let's just say, not what it used to be. There's a lot of economic, societal uncertainty. There's a lot of social pressure to conform with things that may seem to be not a good idea, shall we say. And there's questions about the ethics and morality of the people who are really running society, and how do you evade their efforts to control you in a world that they have an enormous amount of control over? It's a great question. But that's the stuff that, I'm not 21, I'm 32, but I'm dealing with all that, right? We're all dealing with all that. No one's insulated from those problems. But as a 21-year-old, you got to be aware that you probably, hopefully have a certain amount of health and vitality to work with. Hopefully you got the best looks you're going to get, sort of plastic surgery and some pretty serious facial, or like cosmetic dermatology, right? And you got a brain that's like still young and can still move the way that old people can, or old brains can't. And so you just got to use that to your advantage. And that's the thing about, I think, you've got to always be investing in yourself. You are your only real fixed asset. Everything else can disappear, burn down, be taken away from you, or you may not value it tomorrow. It's funny. I'll talk to people about their Apple Watches and their Fitbits and their Whoops and their whatever, and man, they'll ditch those when they find out how bad they're impacting their, heart rate variability or their sleep or whatever. So,
yeah. Touché. Well, Dr. Stillman, thank you very much for hanging out with us today, and thank you very much for taking the time for this conversation and sharing some of your lessons and wisdom. I really hope people are getting lots of value out of this conversation.
And
thanks for the thing is, you work internationally. You have a great working microphone.
I do. I work internationally. I have some. I have to call them clients because I'm not licensed in Europe, but I have some clients in Europe, and love working with people from the continent or England, whatever. People who want to keep up with me and know get my best content should sign up for my newsletter, because a lot of what I know and think doesn't make it out into my social media because, of course, of the censorship that's going on. And then if people want to apply to work with me, they can do so via my website, which is stillmanmd.com.
All right. And there's also your Instagram, your LinkedIn and Facebook name?
I'm on all of those. Yeah, people can find me there.
All right. Well, thanks again to... last minute of the conversation, and my English is dropping down. Thank you again for your time, Mr. Stillman.
Thanks for having me.
And enjoy the day, and thanks for listening. If you have any questions, feel free to drop them in the comments, and I'll make sure I'll get to you.